as you know who I am, I'm Dr. Paul Firnhaber, and I want to thank you for taking like a half hour out of your life to understand some things about your health. Now, why do I do these talks? And some of you've heard this before, but I'm going to say it again. We live in a culture that's the most overweight, diabetic, infertile, depressed, drug-dependent culture in all of human history.
Yeah, and disease.
And yeah, diseased. That isn't right. There's something wrong with that. Okay, when I was growing up in the 60s, we didn't have all this stuff we have now. And so my goal is to help people understand how your body works, how to take care of yourselves, and how to prevent a lot of the problems that people have. So I'm going to start out. This talk tonight is about lifetime care. I'm going to start out with a book that I just got recently. It's written by a full professor of radiology at USC and UCLA. He teaches at both of these medical schools. And he wrote this book called Lies I Taught in Medical School. I want to read you some things out of this book that I think are really important, because this is a guy that thought he was taking great care of himself. And here's what he says. He says, he was in his early 40s when this happened. He says, then I developed 4 diseases that I had been taught and had taught others were aging-related diseases and possibly with a genetic component. He developed hypertension, which I needed high blood pressure medicine, gout, for which I was prescribed drugs to control, dyslipidemia, which is abnormally high blood lipids or high cholesterol, for which I was prescribed statins, and pre-diabetes, for which I was also prescribed another drug. My father developed all those diseases by his 80s. They eventually killed him. I was getting these diseases, but I still had daughters under 10 years old. I wasn't going to survive long enough to see them in high school. That made it personal. Obviously, I was concerned and confused. Now listen to this part. How could this be happening? All the settled science told me this was impossible. I had been raised by a professional nutrition specialist, a certified dietitian. So I'd eaten exactly as recommended by health organizations in the food pyramid. I'd been raised from birth in a system that assured me this couldn't happen to someone my age. I did everything right, and I was going to die. What do you do about that? So how was he eating? How do you think he was eating? And we're going to get into my slides. So he was eating exactly like his dietitian mother, who was taught in the 60s and probably late 50s and 60s. How do you think he was eating that was causing him to get the problems that he was having?
Well, it's the upside down nutrition table that they put out. And if I remember right, fats were bad. You know, it was.
So he was eating, you're right.
Yeah.
He was eating a high carbohydrate, low fat diet. Exactly what I was taught in the 80s. Exactly the way it was taught. Totally wrong. Okay. How else was he eating? How else do you think he was eating? Yes.
A lot of artificial things.
Just probably the standard American diet. But here's what else he was doing. He was eating margarine. He's putting margarine instead of butter on all of his food, or on his potatoes, his bread. Yeah. You know, margarine basically destroys the cell membrane of your cells, and it makes your cell membranes completely dysfunctional. Okay, which causes what? Disease. He was also cooking with seed oils like safflower oil, Crisco, corn oil, sesame, all the oils that cause your blood pressure to go up and cause cellular destruction. And he was taught that all that was okay. And so he started doing research and found out that about 10 things that he was teaching in medical school that were complete lies, that were just, that wasn't science-based. And that's why he wrote this book. Now, I'm not real far into it, and pretty much everything that he has said so far, you know, I've known for a long time, and it's been written in other books. But I thought it was interesting. There's a full professor in UCLA and USC Medical School writing a book like this, and I'm just interested to see what else he has to say. So let's talk about lifetime care. We're going to talk about 4 important aspects to lifetime care. So what is most of people's approach to lifetime care? Anybody? How do people, what's their people's approach to taking care of themselves, lifetime? Anybody?
Exercise.
What?
Exercise.
I wish that were so. That is for some people, for sure. And if that's for you, that's great, okay? What's the dogma out there? Anybody?
Talk about smoking cigarettes and drinking
So
excessive.
yeah, don't smoke, don't drink, and those are good, okay? But
Yeah.
let's look at some of the dogma, okay? How about if it doesn't hurt, there must not be a problem? Is that true?
No.
Is this true? Is this attitude a good basis for sound health care?
No.
Why? Why isn't it?
It's evasive.
Why isn't it, Brianna?
They like hide under the surface, and it's just, it gets worse, and then when it does hurt, then it's worse of a problem than when it started.
Well, you can have colon cancer and not know it.
Yeah, exactly.
Mm-hmm.
How many of you have ever known somebody that had cancer
Mm-hmm.
and didn't know it, and it was just discovered accidentally when they went to a physician? They had no symptoms. I've known multiple people like
Yes,
that.
I am.
Multiple people. I had a friend of mine who went to his doctor for a checkup just because he thought he probably should. They discovered he had 3rd-stage kidney cancer, and 5 days later he's in the hospital having his kidney out. He had 0 symptoms. Didn't even know he had it. How many of you have had people, known people, that have just dropped dead of a heart attack that didn't even know they had heart issues? I know people like that, you know? So this does not make sense. Whether we hurt or whether we feel something isn't a basis for sound health care. Okay, so this is like, we're going to wait till there's a big problem and then we're going to do something about it. But that big problem may kill you before you can do something about it. Okay, so if your car doesn't have a seized engine, you don't change the oil, right? That's basically that philosophy.
Yeah.
You know, we change the oil because we want our cars to work for a long time. But this doesn't always mean that we want to pay the price. And here's the problem, is that lifetime care is an ongoing process. And this has been a problem for a long time. People make fun of people who exercise regularly. That isn't as much of an issue now as it used to be.
Mm-hmm.
Or eat a healthy diet. Has anybody ever called you a health nut in here? I mean, you know, really? How do you answer that?
You don't apologize anymore. You've just been doing it for so long that you have to kind of look over it and just, it's been a while, but
I just say, well, what are you, a disease nut? You know? I mean, you know, that's the way I answer it. If somebody says that to me, are you a disease nut? I mean, of course I'm a health nut. I want to be healthy, you know?
Yeah.
So it's the same with chiropractic care. You know, they may say, you know, you could go for a while. Did they fix you yet? You still going back there? Even when you're free of pain? We're going to talk about that in a minute. So here's the thing. We're each designed from birth with a blueprint that provides a template for health. And your spine is really the blueprint, okay? And the degree to which we reflect that blueprint is the way we take care of ourselves, the degree of quality and quantity of care. If subluxations are present, misalignments, that blueprint is altered. And here's what's going to happen, and we know this for a fact. Subluxations make your body age faster.
What was
Make
that
your
again?
subluxations, misalignments in your spine,
Oh,
okay? Putting pressure on your nervous system.
uh-huh.
Make your body age faster. They make your spine age faster, and they make you age faster, okay? And we know that for a fact. We actually have research that shows that now, and I talk about that in another one of my classes. So when we exercise because it enhances our life. By the way, what is one of the things, other than chiropractic care, which is one, what's one of the things that you can do that will slow down the aging process a lot? What's one thing you can do related to this?
Sugar?
Well, eating sugar.
A sedentary lifestyle.
Will what slow down the aging process?
If you don't exercise, if you're just sedentary all day.
That'll speed up the aging process. Yeah.
Oh, you said slow down.
Yeah, what
Slow
slows down,
Yeah.
what specific thing that you can do that will absolutely slow down the aging process?
Walking.
Walking is helpful, okay?
So.
But there's something else I'm getting at. I'm getting it. It's okay. I'm glad you're thinking about it.
Okay.
It's preserving muscle mass.
Ah,
If
okay.
you preserve muscle mass, you will slow down the aging process. So if you're lifting weights regularly, doing things that add muscle or preserve muscle, I guarantee you're slowing down the aging process. Any reason, like I'm just going to ask a really hard question now. Why is that? Why is one of the reasons that is?
Blood circulation.
Okay, it helps with that for sure. That's not too bad of an answer. Muscle burns fat, and it burns sugar. It burns glucose. So when you add muscle, your muscle constantly, it speeds up your metabolism, and it constantly burns fat and sugar, okay? So what about working on our brain? So doing things for our brain, like reading regularly, playing an instrument, helps our brain to last longer.
Mm-hmm.
What's one of the biggest problems in our culture right now? Huge issue.
Cell phones. Sorry.
Well, cell phones are an issue, but what would you do?
Well, I was gonna say TV, or something like that.
Video
Or-
games?
I think
Okay.
it's being passive.
I would say related to this.
Okay,
I'd say
Related to
stress.
this.
I'd say stress.
How about Alzheimer's and dementia? Alzheimer's is becoming like the #3 killer in the country. People's brains are degenerating.
Mm-hmm.
Now, I have an entire 30-minute class on Alzheimer's, but this is a big issue, so we need to keep our brains healthy. So, lifetime care. You folks are in a minority because there's not a lot of our population that will take care of themselves regardless of how they feel. And it takes a certain level of evolved thinking to realize you don't just respond when there's a crisis, okay? So we don't wait till, the IRS seizes our home to pay our taxes. At least I hope you don't. And hopefully you won't wait till you have a heart attack to take care of your heart. So let's look at important point number 2. Lifetime care is not an outcome, but it's a never-ending process that we must be consistently engaged in. So, so anything that applies to the virtue of existence is a process. Okay, so anybody ever tried to learn a musical instrument? Okay, how did that go? What do you have to do?
Practice.
Practice a lot to get good at it, don't you? Yeah. Okay. So if we look at things that we normally do, exercising, eating the right food, brushing your teeth, praying, loving your family, when are you going to be done with that? I mean,
Never.
yeah, never.
Yeah.
I mean, do you finish brushing your teeth at 50 and say, I don't care if they rot and fall out now, I'm done? One of my goals in my life is to preserve all my joints and all my teeth when I die. I want to have it all, okay? And so you've got to take care of ourselves to do that. So some people, when they start chiropractic care, hear stories, well, you have to go for the rest of your life. You don't have to. You can quit any time. Here's the thing. People go to chiropractors because they become more informed about how it's helping their nervous system and their spine. My mother, who's 93, who still lives by herself, still cooks meals, still cooks for me when I come to see her, still goes out and gets her mail, still cleans her house. You started seeing a chiropractor many decades ago, and she doesn't take hardly any medication at all. And she does 3 things to help herself stay healthy. She sees a chiropractor every week. She takes good nutrition. She goes to colonic therapy once a month. And all her friends who told her she was crazy are all dead. And all her friends who said, no, I'm going to do exactly what my internist tells me to do, they're all dead. And they were all younger than she is. She lost all her friends because of that. So I was just out to see her about a month ago. Yeah, she still cooks for me. We watched the NFL and college football together. It's a lot of fun, actually. So, and my brother and sister are there too, so we have a good time. So anyway, people keep seeing a chiropractor because it helps them stay healthy. They become more informed. Now I want to talk about just a patient of mine, and she's not here. This is a girl that came to see me who's about 20. She's in a car accident, and I saw her 3 months regularly until I dismissed her. And at the last exam that I did on her, she said, can I ask you a question? I said, yeah. She said, you know, I've noticed that since I've been going to you, that my menstrual cycles don't hurt me anymore. I don't get cramps. I don't get all the problems I had. She says, is that a coincidence, or is that, you know, is that, do you think that's something that's real? I said, absolutely. You know, because we worked on her lower back. All the nerve supply to the uterus, the ovaries, and the fallopian tubes all come out of the lower back. So no, it wasn't any coincidence. And you had kind of a situation like that too with digestion.
Yes.
Yeah.
And I don't have it.
Yeah. Do you mind? Can you tell people what happened with that, or?
Well, all I know is that I always used to have to take Tums right before going to bed, because my stomach acid would come up. And after I started care, it just quit.
Yeah.
And I don't take Tums anymore.
Yeah, amazing coincidence, right?
Yeah.
So you didn't even tell me that, you know, until pretty late in his care.
Yeah.
Okay. So a lot of people can't make sense of this, and that's why you know, people tend to make fun of chiropractors sometimes. And my job is to help you understand how your body works, so you can understand why that happens. So here's important point number 3. Caring for your body and your health is something you do at certain moments and not at other moments. And I would say this, we render care to our body at every moment. Even our thoughts constitute care. So, Hans Selye, anybody ever heard of him?
Yeah.
Hans Selye?
Yeah.
Okay, he was a guy that determined that stress actually causes problems in the body. And he found that stressful thoughts, emotional upsets, and cancer grows with stressful thoughts. Okay? He was really rejected for that. And today it's accepted that the thoughts we keep, if we have negative, angry thoughts all the time, they accelerate disease. And peaceful, happy, joyful thoughts, what? They help our body to stay healthy. Okay? So he says adopting the right attitude can convert a negative stress to a positive one. Now here's another interesting individual, Reiki Hamer. He's a German physician. And in the early 1980s, he produced absolutely scientific proof that every cancer has a negative emotion origin and a specific disease, and have very specific emotional traumas. So lung cancer, lung disease, grief or sorrow, stomach and small intestine, indigestible anger, liver is a starvation of love. Let me tell you an interesting story that just happened 2 days ago. I had some patients that came in, husband and wife, and I was talking to them, and I was asking them about their family, and they said, you know, we have this son, and he got he said it was really strange. He got testicular cancer when he was 20. And I asked him a question based on Reiki Hamer's research. I said, did he have a loss of love or a loss of a relationship when he was 20? Because Reiki Hamer found that a loss of relationship is directly correlated to testicular cancer. So I just asked him that question. And they said, yeah. They said when he was 20, he found out that his best friend was sleeping with his girlfriend.
Oh, gee.
And it was tremendously upsetting to him. Well, that just made total sense with what was going on with him. So the emotions that we have that aren't healed, that we allow to take over our bodies, can really produce a lot of problems. So we render care to ourselves by the beverages we choose to drink. Like, do you drink water or do you drink Coke that has 12 tablespoons or teaspoons of sugar? Whether or not we choose to exercise, exactly what you were saying before. The food we choose to eat. Do we eat junk food, highly processed food, or do we eat real food? Okay. How much we chew our food. And I fall down on that one real bad, I can tell you that. Whether we smoke cigarettes, whether we drink to extreme, whether we have limited sugar or too much sugar, whether we consume artificial sweeteners which damage our nervous system.
What is limited sugar?
Limited sugar would be very little, like, occasionally.
I know what that means, but what does that mean to the health of the body?
Well, large amounts of sugar are really damaging to your system. And so limited sugar, you're not raising your insulin levels all the time and causing your blood sugar to go up. So what about when we sleep? Are we rendering care to our body when we sleep? Well, what about if we go to bed angry and those thoughts just percolate in our mind all night long? Anybody in here ever have an argument with your spouse right before bed? I'm the only one that's happened to. Okay. Well, okay. It can be a problem. All right. So lifetime care is not a choice. Really, the only choice is the quality of care that we're going to engage in, because every single person here is engaged in some sort of lifetime care. The food you eat, the amount you exercise, how you take care of yourself, we're all doing it. We're all engaged in it. So if you have a friend who says to you, are you still going back to that chiropractor? The question should be, are you continuing to make greater improvements in the type of care that you're rendering to yourself? Now, I have some good friends that we actually talk about this. Like, what are you doing to work out? What are you doing to stay healthy? We bounce those things off of each other. So, then I have this thing on coronavirus, which I don't want to talk about right now. What about rendering care to children? This is really important. Children don't learn how to treat themselves based on what you tell them, but based on what you do. And behaviors are caught. Kids respond incredibly well to chiropractic. And let me give you an example of that in my office. I have this the school teacher who drives in to see me from out west, and he was almost incapacitated, and I got him better again. We worked with him all summer, and he's able to teach again. But he has a 3-year-old daughter who's got cerebral palsy, and she's really smart and really got a really neat little personality. She had no muscle tone. She couldn't, you'd sit her down, she'd just fall over. And so he started bringing her to me, and we started working on her just once a week. That's all I was able to see her. I've seen her probably, what do you say, Carmen, about 8 times maybe? Is that about accurate? Yeah. Well, she can sit up on her own now without falling over. She can just sit up. She has enough tone in order. Now, she's not walking at this point, but she's able to sit up and play, and she could not do that before she came in here. Chiropractic works great on children. Now, I didn't know that was going to happen to this little girl because she had some digestive issues too. She had a really, really hard time pooping, and that was the first thing that got better when I started working on her. And then the tone started changing later on. Kids respond incredibly well to chiropractic. So my request to you as your doctor of chiropractic, who takes care of your spine and nervous system, which controls everything in your body, is to keep up with the spinal exercises I give you. Pay attention to how you're doing in your workplace. I mean, if you need to stand up, because sitting is so bad for you, then stand up or get a standing desk. Remember, here's the thing, if we don't use our ligaments regularly, this is why exercise is so important. What happens is they fibrose and they get hard and they get stiff. That's why it takes 6 to 12 months to bring the curve back in somebody's neck, especially when they're older, because the ligaments that hold the bones together, if you've abused your spine and you've been in multiple car accidents and really haven't done a lot, those ligaments, they contract and they get hard. They're not supple. And so that's why it takes so long to stretch them out and get the curves back right in your spine. So that's why we have to adjust people multiple times to get those ligaments back to working properly. So some people, and I know you know people like this, have the habit of going from health tragedy to health tragedy. That's a form of lifetime care. I know people like that. You know, I've had patients like that. It's crazy. So if that's your philosophy, you're going to be really frustrated in my office, because we want to encourage lifetime care based on wise choices, eating right, taking care of yourself, exercising right. So our society has given us so many confusing messages regarding health and diets. Anybody ever seen really contradictory information on diet and nutrition? It's out there. Yeah. The low-fat diet, the high-fat diet, low-carb, high-carb diet. There's so many confusing and contradicting diets and health advice out there. That's why I do these classes, so I can give you things that are accurate, that are based on science, and that actually work. So I'm not necessarily here to treat how you feel, but to make sure that your brain, your spinal column, your nervous system is operating as best as it can. I'm not saying that you're never going to have a symptom again, or you're never going to be in pain again, but it means that you're going to age a lot more slowly, and you're going to repair faster. And that's my goal. You know, we all have issues at times, but if your body's healthy, you can it can recover a whole lot faster. So that's all I have today. Does anybody have any questions about anything I've gone over? Yes, Randy?
So if you have high inflammation from eating a bad diet, then it may take longer for chiropractic care to work because of your inflammation from a poor diet, right?
Yeah, it not only may it take longer for chiropractic to work, but if you have surgery, if you go into a surgical procedure with high inflammation, you're not going to heal very fast at all. And the chances of that surgery being unsuccessful are going to be a lot higher. Yes, your body can't heal with high inflammation. It's just got too much else to do to be able to heal your body. It's a great point. Yeah, Conrad, do you have it?
Well, the latest national news from the CDC is that we have so many young kids who are now overweight and getting diabetes much sooner and cancer much sooner. And in fact, it was repeated tonight. I watched national news before coming here tonight again. It was mentioned again by the CDC, the need to take care of this. And of course, another problem is the high cost of drugs that was on the news tonight. $1,000 for American people and $79 in Europe.
Yeah, that's right. Yeah, that's exactly right. You might as well fly to India to get care. It's cheaper. You know, so that's right. Does anybody know the percentage of children, you know, we're talking about kids 18 and under, that have a chronic health issue?
Yeah.
Does anybody know what percentage that is right now? Anybody? It's 54%. Okay.
Yeah.
Okay, that's out of a pediatric journal. I just looked it up last week. 54%. When I was in high school, back in the late 60s, it was probably 1% or less. I mean, nobody had people with chronic health issues back then. So we have a serious issue, and that's why I do these classes. So you have an idea of how we're supposed to take care of ourselves, how we're supposed to eat, what causes things like Alzheimer's disease and autoimmune disease. I have classes on all of that. So that's why I do these. And you may know people who have problems, who have health issues that aren't getting fixed. Have them call my office. You know, I'll do a spinal health screening at no charge. I mean, at our expense. You know, it's 4 simple tests. And if I find something, I'll tell them. If I don't, I'll tell them that too. I mean, if they have issues that they haven't been able to get rid of, you know, we might be able to help them. You know?
I wanted to ask you, is anybody teaching those children how to eat right? Because I had to teach nutrition in the preschools to children.
Well, I hope somebody is. I'm trying to teach them. You know, I'm trying to teach their parents at least.
Well, we were just teaching the children, and I used to tell them, food is not for your taste buds. I mean, cake and cookies and all that, and ice cream, but it's for the health of the inside of your system.
Yeah.
Keep you going.
And if you look at school lunches, are they healthy or unhealthy?
No.
Not very healthy. You know, they're not going to keep them. They may keep them alive, but they're not going to keep them
We
healthy.
used to cook with the children.
Yeah, that's good. Good for you. So, good. Yeah, one other thing. Arlen?
I have a friend that, her daughter, had some kind of a dot under her tongue that the dentist found when she went in for, her teeth to be cleaned. And it turned out that spot was cancer.
That can happen. And she didn't even know she had it, did she? Carmen?
Somebody that's online asked, how long should you use a standing desk during the workday? All day or part of the day?
As long as you feel you need to.
Okay.
Yeah. Yeah. As long as you feel you need to, for sure.
Okay.
Okay. I mean, that's a little bit of a nebulous answer, but everybody's different.
Yeah.
So,
I got a question. Where did you get that book?
I got it for my birthday.
Great.
But they have it at the library.
Great, yeah.
They have it,
have it at the library?
Yeah, but I know they have a waiting list for it.
Yep.
Amazon?
You can get it on Amazon, yeah.
Oh, okay.
And it
in
was
the
published,
library
it just
every
came
day.
out in June, so there aren't any used copies. You know, you gotta buy it new. You gotta bite the bullet, okay? Yes.
You get it at Barnes and Noble?
Yeah, you get it there.
There is a book which I was lucky enough to find. It's by a Dr. Aziz, and I don't remember what university he worked out of, but he was a proponent of many of the things you were talking about that came from this book. Very similar recommendations and
Yeah,
so
I believe you. This book, I mean, I bought it because I just wanted to see what he said. But so far, I haven't learned really much of anything because I have a whole library full of books that are saying basically the same thing this one is saying.
Yeah.
So they're all saying that the standard American diet is terrible. Drugs are bad for you. You need to take care of yourself. And you need to eat a whole food diet. And there's certain parameters of blood work that you need to keep under control. They're all saying, okay? And that, so, and I talk about that in my nutrition classes. In fact, later on this year in December, I'm going to do a class just on how to interpret blood work. So if you want to learn how to do that, I'm going to do a class on, I think it's December 17th. So we'll talk about that then. So anyway, it's after 7. I told you I'd only keep you a half hour. I want to keep my word. Thank you, everybody, for coming tonight. And are we doing emotions and health next time? So my next class in 2 weeks is called Emotions and Health. And we're going to do it just simply concentrate on how emotions affect health and how we can actually test for that. So thank you so much for coming, and I'll see you in 2 weeks, hopefully.